Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlon Pickett. A show about how you can live longer with more cash and flexibility to really enjoy those years and never run out of money. Harlon will take your calls on a variety of topics related to health insurance, health care, retirement income planning, Social Security, thrift savings plan, 403b, 401k, or just about anything that gives you the tools to take action on keeping more dollars in your pocket and putting more dollars towards your retirement. He'll even share a few industry secrets if you listen close. And now, here's your host, Harlon Pickett.
All right, welcome back to the Health and Wealth Power Hour. We are really glad to have you with us again today. We had such a great response from our show last week. I want to thank everybody for listening, all the great comments we had both on social media and also the great emails. Appreciate everyone taking the time out of your Thursday to listen to us. I had a very interesting week as the week kicked off. A lot of times you get real busy, and you kind of lose focus of all the folks that you can help. But man, I'll tell you, I had a couple of folks reach out to me at the beginning of this week that just had the kind of issues that I adore helping folks with. First young lady called me up. She was a referral from her mom, who I had helped this young lady actually get insurance a number of years ago whenever she was a student. Now she is graduated. She needs to get her own plan. And she's got a job, getting a salary. Her business does not offer insurance. So she was looking at the plans. She had actually talked to a couple of other people, and everyone was putting her at plans between $350 and $400. Now, that may not seem like a lot for many folks, but this young lady's only 24 years old, working at about a $30,000 salary. I'm sure that with her degree, she will be moving up that food chain pretty quickly. But right now, that amount is a little more than what she could stomach. She had decided to give me a call at her mom's bequest. Amazing how that works. I was the last call that she made because that was recommended by her mom. So, you always kind of have that kid that didn't want to call who their mom and who their parents say. Got a couple of those myself. And what happened is within the first few minutes, she goes, I already know more right now than all the other people that have talked to me. You've already explained more to me about how this process works. And while I really wanted to lead her away from a marketplace plan, because really it's kind of difficult dealing with all of that sometimes, having to prove your income, all the other things that qualify you to be marketplace, where she belonged at this point in her career is in a marketplace plan. And we were able to get her an outstanding plan with low deductibles, low co-pays, covered up all her preventatives, and she's going to be paying less than $200 a month. In fact, way less than $200 a month. And she was extremely happy. The doctor that she has got to know as she had moved into town was on this plan also. And so she was very, very happy to find that plan. And that's a pretty common thing, is me talking to folks each week and looking to find the best solution for them. While obviously one of our big sponsors on the show is Eagle Care Health Solutions, and we really like to give folks the lowdown on that plan and how it can help them, it is not always the best solution. And I want everyone out there to know that we are going to do our very best to find the plan that works for you and for your family, and most of all for your budget. Because folks, no matter how great a plan is, if you can't afford it, it ain't worth a hill of beans. If you can't stay on that plan because the premiums are too high, it just ain't going to work for you in the long run. One of the other folks that I helped this week, a little bit different situation, 53-year-old gentleman. He had been misdiagnosed, I guess you can say, with diabetes a few years ago, and since that time he had been told by numerous people that he did not qualify to get a standard insurance plan, that they would not underwrite him, and therefore he had to get some kind of alternative plan. Now, as I found out, it is unfortunate that the people that were telling him that were absolutely after doing one thing: selling him that alternative insurance plan. As he has learned over the last couple of years, that plan just does not cover a whole lot. So we are looking to find him solutions that make sense for him. And I really want to show him lots of different options. He certainly can go back to the marketplace. He can look at those type plans and find out if one of those works for best for him. Or he can look at alternative plans like Eagle Care Health Solutions and other type health shares. But as I work through the process with him, I really want him to understand that we're going to have his best interest in mind, and we're going to make sure we find the plan that works best for him, because you are not excluded from insurance plans because of any type of diagnosis these days. We can always find something for you. Pre-existing conditions, whereas they were a big deal back when I got into this industry a long time ago, they are not as big a deal anymore because we have plans that can help you. That is one of the things that I think is a big misconception. It obviously was with this gentleman, and I hear about it all the time. I've got this, and so I can't get a real plan. Yes, you can. We can find you something. We can find you something that will take care of you, that you can get your medications, that you can get the care that you really deserve, that you can have access to health care that you really deserve. It is a crying shame that I hear all the time that people are paying for a plan that they're afraid to use simply because I've got a high deductible. If I go to the doctor and he tells me something's wrong, I could never afford to go to the doctor. I could never afford to go to the hospital. And that is a shame because it is not giving them any peace of mind to have that plan. And we want to be sure that folks have that peace of mind. So that is really what we are focused on at Eagle Care Health Solutions. We are focused on making sure that you have the peace of mind to know that the plan that you have is the right one for your budget and for your family's healthcare needs. One of the other things that I did want to point out on all Eagle Care plans, they include Teladoc. Teladoc has been a huge deal over this last year as more and more people avoided going into doctor's offices simply because of the pandemic. Folks were afraid of actually getting sick by going to the doctor, and many doctor's offices actually shut down during that time. And so telemedicine became a bigger and bigger thing during the year 2020, and that has continued into 2021. Don't be afraid of Teladoc. It is an outstanding service. It's amazing how many things that they can diagnose and really treat you for or give you treatment for, whether that's self-treatment or even give you medications, write you a prescription for, in Teladoc. I myself have used it a couple of times for poison ivy. Why go to the urgent care or anything else? If you pretty much know what you have and you got poison ivy, they can take care of you and make sure that you get that the cream that you need, and even write a prescription for a steroid if you need it. But it's really a great service to have Teladoc. I highly recommend it because I think you'll find once you have it that it is just so useful that you're going to use it more than you ever believed that you would. A lot of those little things that you would maybe take your kids to school for, or to instead of keeping them home from school for, you can now take care of right on the phone. Got a lot more to come. I appreciate everyone spending time with us today. We will be back. Welcome to the Health and Wealth Power Hour. Welcome back to the Health and Wealth Power Hour. I am your host, Harlon Pickett. I believe we have a caller. It is Kim. Is that correct? Kim.
Yes, it is.
All right, Kim. Thank you for calling in today. How can I help you, sir?
Well, I just had a quick question for you, Harlan, and that really has to do with as a small business owner, which I am.
Okay. What kind of business you own there, Kim?
Well, I own an insurance agency, small life insurance agency here in Houston, and we specialize in final expense insurance for families across the country.
Okay.
And, we're interested in providing benefits for our salespeople, which are 1099 independent contractors, as well as our employees, customer service and accounting and so on and so forth. So is it possible to offer your Eagle Care product for my independent team members as well as W-2 employees.
Okay, so you got a mix of both. What I'm hearing you say, Kim, is that you do have a staff, so you have some folks that are salary type employees, and then you also have your 1099 contractors, typically your sales folks, as I know from insurance. Is that correct?
That is correct.
All right. Well, the good news for you, Kim, is that yes, sir, Eagle Care Health Solutions can offer product that will work for both of those folks, and you can actually offer the whole variety of plans to each of those, whether they are 1099 or a W-2 employee. As the sponsor of the plan, you can select on any of the options or all the options that Eagle Care to offer to your employees and your 1099, and then they can choose from all of those. So yes, sir, you can absolutely offer it to a mix between the two.
Okay. And it sounds like you have a variation of plans. So the only other question I have for right now is what would the average cost for your Cadillac Health Solution for, say, one person, just a ballpark average price? I know it's hard to do that without details, but if you can just give me a ballpark of what we'd look at.
If you're going with the very top end plan, which would the copay plan, that's the Eagles Peak plan, it's going to average around $400 per employee for that plan. Obviously, some could be less. You really can't get much higher than that, even with someone that was in their 60s, obviously below Medicare age, say even in 62, 63 years old. They would be around that same $400, and then, of course, some folks would be less. Now, one thing I do want to point out to you is if they were going to add their entire family, then we're not talking about a family of 5 or 6 now that you just times that 4 by that 6. The Cadillac plan for the entire family with a $2,500 out of pocket is going to be right at $1,000 or less, Kim. So adding their family to a plan would not be as restrictive as it is on many of your employer plans that once you trying to add your family, now your plan gets up to around $1,400, $1,600, $2,000, and that's just too cost prohibitive for many folks.
Oh, I understand. Yeah, I had and I don't want to, I had a health plan a few years back for my family that, my goodness, I think it was like $2,800 a month, and you just sit there and you feel like you're working to pay for your health insurance, and hopefully there's money left over to pay the rent and put food on the table. So it was the biggest single expense that we had.
Yes, sir.
So it sounds like your premiums are in a affordable range where you could provide good protection at a good price.
Yes, sir. We have worked diligently to be sure that the plans that Eagle Healthcare Solutions offers can meet the needs both in access to health care and also budget-wise, so that folks can truly utilize it. As I may have mentioned earlier, no plan works very well for you if you can't afford it. I mean, just hearing you say $2,800 a month for a plan, I'm sure there's a lot of folks listening out there right now just cringing at the thought of that. And I have certainly seen that, and I have seen folks paying even more than that. And that is a shame. It really is a shame that the cost of health insurance and healthcare has got so high that folks find themselves in that situation. Is there any other questions I can answer for you today, Kim?
No, I think I'm good at this point in time, but thank you so much.
Yes, sir. And if you want some more information, you want to talk about your company, have us run some quotes for you, sir, you can get us online at eaglecarehealth.com or 512-859-5662. That's 512-859-5662. Thank you for calling in today, Kim.
Absolutely, Harlan. Thank you, sir.
All right, great. That was such a great question that he had, because most of the time that we have historically looked at companies that have W-2 and also have 1099, the 1099s are always left out in the cold. Being from the insurance industry, I can tell you that is one of the things that we see over and over and over is folks in real estate, folks in insurance, all of the different things that people do nowadays, and more companies switching to 1099, those folks are getting left out in the cold, and Eagle Care Health Solutions can help them. All right, looks like we got another caller. Olivia.
Hi, yes.
Oh, welcome to the show, Olivia. So glad to have you with us today. How can I help you, ma'am?
Yeah, I have a quick question. I work in the restaurant industry, and the company or restaurant that I work for doesn't offer health insurance as a benefit. So, do you think Eagle Care would be a good program for me?
That's a very good question. You work in the real estate. Listen to me. I'm sorry. You work in the restaurant industry, and I'm sure that you probably know this, but if you've worked in it, you've probably worked in a few restaurants potentially. And pretty much none of them are going to offer you health insurance of any kind unless you're in management. And, let me tell you, one of the reasons they do that now is because I'm sure, as you have seen, there can be quite a bit of turnover in the restaurant industry. And a lot of times it's just not worth their time to go out and find a plan for somebody.
Mm-hmm.
But what I see mostly in the restaurant industry, Olivia, is that a lot of those folks do end up better off on their own plan, an individual plan, whether that's an Obamacare plan or a truly individual plan. And without knowing all of the details about your situation, if I knew your income, and I'm not asking for that now, Olivia, I don't want to get personal information on you now, but knowing your income, knowing your situation, what your tax situation is on how many people you're going to claim, looking at your whole situation would help us determine where you would best fit. Could Eagle Care Health Solutions be a solution for you? Absolutely. It could certainly be a great solution for you. It could also be the wrong solution for you because you may have something going on that would put you in a marketplace plan in a much better situation. So we would have to look at you all the way around. Once again, look at your income, look at your home situation, look at any other tax dependents you may have. Take all that into consideration before we'd make any recommendations for you. Overall, I think Eagle Care Health Solutions can be a great fit for many folks, but you're always going to find people that are going to be better off in a different situation, and we're going to make sure that you get what fits you. I'm sorry I couldn't be a little more direct in the answer there. Depending on what your situation is, Eagle Care could help you save money, or it could cost you more, and so you may be better off with a marketplace plan. If you would like to reach out to us online at eaglecarehealth.com or 512-859-5662. I could certainly walk you through the process and make sure you got the plan that best fits your situation.
Okay, perfect. I'll fill out a form on the website.
Okay, great. And do you have any more questions for me, Olivia?
Nope, that's it. Thanks for your time.
You're very welcome. You have a blessed day, ma'am.
You too. Bye.
All right. Wow, we are getting flooded with calls today. What a wonderful thing. All right, we have Cassie calling in now. Cassie, how can I help you today, ma'am?
Hi, Harlan. How are you?
I'm doing great. How are you today?
Wonderful. I'm doing great. I'm kind of on vacation.
Hey, all right. All right. And that's me next week. Next week I get to take a little bit of a break.
Well, yeah, spring break.
Yep, that's it. Yep, spring break.
I have a couple questions.
Okay.
I've been in real estate for quite a while. And as an independent contractor, I have my own insurance through the exchange, and I pay about $700 a month, which I feel like it's way too high. I was hoping maybe you could tell me a little bit more about Eagle Care, how the program can help me.
All right. Wow, Cassie, do you enjoy paying $700 a month for your plan by yourself?
No.
Okay.
Negative.
All right.
Not exactly.
Okay. That's not a completely shocking number. I have heard obviously higher numbers than that. And if you were listening just a moment ago, we had a gentleman who, for his family, was paying $2,800 a month. But $700, even if you are an extremely successful real estate agent, that's still a pretty good chunk of change going out for a plan just covering yourself. The answer to your question is yes, you could definitely get a plan, even a top-of-the-line plan with a very minimal out-of-pocket for yourself. You could get the absolute Lamborghini of Eagle Care Health Solutions plans and still be far, far below that $700 mark. Now, one of the things that we would have to obviously take into consideration is any health issues you may have, and look overall at what your situation is. But there are other options so Eagle Care Health Solutions obviously is one of them, but there are options for you that would certainly save you money in this situation, Cassie.
Okay. Well, I'll go ahead and look into that.
Okay. Yes, ma'am. You said you had a couple of questions. Do you have something else you want to ask me today about, ma'am?
Yes. How can I find out more about the Eagle Care?
Okay, great. It is very easy to contact us. You can reach us at eaglecarehealth.com or 512-859-5662. That's 512-859-5662.
Okay, I got it.
Good deal. Well, look forward to hearing from you, Cassie, and we will get you all set up.
Thank you very much, and have a happy spring break.
All right. Thank you. You too, ma'am. All right. I'll tell you what, it is so great to talk to you good folks out there. I enjoy what I do so much. Thank you so much for being so welcoming to our show, and we will be right back with the Health and Wealth Power Hour. All right, welcome back to the Health and Wealth Power Hour. This is your host, Harlon Pickett. What a great first half of the show. It is awesome to have folks call in with such interesting questions and situations. As we move forward into, we're almost into the second quarter, folks. Wow. Moving into the halfway point of March. One of the things I did want to point out is that there is right now a special COVID open enrollment on the marketplace that is going from February 15th through May 15th. And if you have been affected by the loss of work, or maybe you just didn't get into the plan that you wanted to last time, or you got into the wrong plan for you. Maybe you found out that the plan that you have, your doctor doesn't accept, or he did and he doesn't accept one now. You can actually change plans. So all of the attributes of this special enrollment period are just like traditional open enrollment that you have from November 1st to December 15th. Now, of course, we are talking about individuals on that. One of the things that Eagle Care Health is really focusing on are small groups. We have seen so many small groups that have elected during the last year and a half now to get rid of their plan because it was about their survival. They had to cut costs somewhere, and benefits were the place that was the usual suspect, as it were. Now, of course, one of the big negatives of that is the fact that here we go. You're in the middle of a pandemic, and now you just cut the benefits to your employees. In many cases, some of those same employees had to be let go, and then when you tried to bring them back, they would not come back because of the different programs that are available right now for unemployment. Many of those folks were making more money not working than working. You look at all of these situations, and small businesses were really put in quite the lurch in trying to find folks and not being able to offer benefits. That is another primary reason that Eagle Care Health Solutions did what we did. We put together a plan that employers could afford and that their employees could afford. I have a small group that I've been working with, 54 employees. Only 17 accepted the plan. And that is because of the huge amount of money the plan cost. For the young lady that owns the business, she pays $24,000. That's her part. She pays $24,000 a month for just those 17 employees that accepted the plan. It becomes a bigger and bigger deal. It's a bigger drain on your company. And then you offer a plan and your employees can't take it because of the cost. It's a vicious cycle that just goes on. And even if you were to switch providers, which we see all the time, folks switching from one carrier to another just to get their rates back down, just know that that 15 to 40% increase is going to come every single year. You can avoid that by getting away from that cycle and getting into a plan that your employees can truly use and that you can afford. That is another reason why Eagle Care Health Solutions was brought into existence. We really love helping that small business owner. That's what we are too. That's exactly what Eagle Care Health Solutions is. It is a small business that is dedicated in helping other small businesses. We are not leaving the individuals out. We certainly have plans that work for them too, but our focus is definitely on the small business owner and helping them get through these times and helping them attract and then keep good quality employees. Because that is the biggest thing. I can't tell you how many times I have seen the small mom and pop AC company, plumber, electrician. They get this guy right out of trade school or maybe even high school, and they teach him all the tricks of the trade, get him going, and all of a sudden that kid now has grown up, he has a family, and he has to move on to a bigger competitor because that small mom and pop cannot offer benefits. And now with a child on the way or a family starting, that individual has to have benefits because that is just what's expected. They're expected to have those things to be able to provide for their family. And it's a sad situation as they go through that cycle over and over. So here is a small business person, once again, back at square one, training somebody else. And I've even seen it where it was one of their children that they trained, and then that child had to go work for a competitor simply because they needed the benefits. And it doesn't get much more heartbreaking than that, than a small business losing their own family simply because the benefits are not affordable and they can't have that for their own family. One of the other issues that we see in really the health insurance industry across the board is everyone asks, why have the rates gone up so much over the last few years? It really is an interesting question because people haven't got sicker, right? If they haven't got sicker, then why? And I guess you can say, yeah, in the pandemic, people have got sicker, but that's not really what I mean by that. I mean, the health overall, as far as longevity, we're living longer. Well, if we're living longer, then why are the costs for healthcare going up and up and up? Because we're not really talking about Medicare age. As people live longer and they're in Medicare age, that's not going to trickle down into the under 65, which is what is skyrocketing. But what has happened is all of these plans that these carriers offer on the marketplace, whether it's an on-market or an off-market, have to follow ACA rules, which mean that they cannot exclude you if you have a pre-existing condition. While in theory that is great, what happens is it makes it where it is really not insurance anymore because the definition of insurance is the sharing of risk. If I cannot ask you any medical questions and I cannot set my rates based on those questions, the answers to those questions, then really the insurance company is the only one taking the risk. Now, I'm not defending the insurance companies. They certainly are making plenty of money. But they have to set the rates based on everyone being sick. And that's what they're doing. They're saying everyone is the same. It's community rating. And they're saying everyone we have to look at is going to be filing claims. The more that they are used, the higher the rates go. Even last year, where we saw a decrease in use by plans, we typically still saw an increase in rates for this year as they anticipated a bounce back of people looking at elective surgeries and other things that they put off for last year. They said, okay, well, that was an anomaly. Let's go ahead and kick up the rates for 2021 because as things get back to normal, whatever that is nowadays, people are going to start doing some of those things that they put off. Well, that means, once again, the rates go up. And you have situations where folks such as myself, we were, before Obamacare came along, we were paying less than $800 a month for my family of four. And now, if we were going out looking at the same type of plan, not the same exact plan, because that plan doesn't exist anymore. You cannot buy a PPO anywhere in the state of Texas that is a on or off exchange plan. So the plan we were on is gone, but anything that we would get that is similar to that would cost us somewhere around $2,000 a month. whereas the plan that we are on with Eagle Care Health Solutions, which is a top-of-the-line plan with copays and all the bells and whistles, teledoc, got the prescription drug coverage, got all of those things, is costing us less than $1,000 a month. So a big savings. Obviously, if my family's saving $12,000 a year, that makes a huge difference in our budget and the way that we're able to live our lives. You talk about $2,000 a month, that's a whole lot more than many people's mortgage these days. The gentleman that called in earlier that was paying $2,800 a month for his family. Can you imagine paying that much? A lot of folks have a $1,200 to $1,500 mortgage, and this guy's paying almost twice that just for his family's health insurance. As he mentioned, it was the highest expense that they had for the entire family, and that's crazy. We really shouldn't have got there. That just doesn't make any sense to me that we have got to the point where our health insurance costs so much. And when you look at that, and I want you guys to understand that health insurance is not health care. You do not really have to have one to have the other. We have really been brainwashed in this country to think that you have to have one to have the other, and that is simply not the case. Eagle Care Health Solutions' motto is, it is not health, it's not insurance, it's better. And we really mean that, because you don't have to have insurance, traditional insurance, to get quality health care. There are many organizations now, we talked about DPC before, and there are even surgery centers here in the Houston area and in Austin that I know of for 100% fact that have a price list. You can go out onto the internet, you can look up the cost of a turnkey all the way from visiting with the specialist to begin with to if whatever procedure you're having done, at the end, you get all of your physical therapy, and it includes all of that for one price that is just pennies on the dollar compared to what it would be if you had a traditional insurance plan and you had to go through one of the big box hospitals. How can they do that? Well, they can do that because they don't accept insurance, and they don't have to charge rates differently and charge more so that they can get paid the amount that they can to keep in operations. But of course, why are the prices higher? Well, a lot of that's because of the administration that you have to have for all of those insurance plans and for Medicare. All the administrative procedures they have to go through, all the billing codes, all of the things that are take away from the care. The growth on the administrative side in the last 10 years is just exponentially higher than that of the caregiver side. We're just not seeing the same kind of growth. I believe the numbers I saw here recently over the last 10 years, we've seen about a 3% growth in caregivers and about a 1,700% growth in administration for hospitals across the country. That's just insane. Think about that. The people that actually do something for you are not the growth. It is the people that have to file all the paperwork and send you the bills and deal with you, checking in and checking out. All of the administrative part is what hospitals have to concentrate on, and that's just not right. That is not giving folks access to the kind of care that they deserve. And we really focused our plan and our thought process on making sure that people get the care that they deserve at an affordable price so that people can really concentrate on their care and not on worrying about whether they can meet their budget. If you have any questions for me, please reach out to us. Number to contact us is 281-558-5738. Health and Wealth Power Hour. Be back. Oh, yeah, we are back. Health and Wealth Power Hour. I am your host, Harlon Pickett. Nothing like a little REO to get us rolling, baby. All right, I like it. What a beautiful Thursday. Might be cloudy outside, but it's still, what a great temperature. About 6 months from now, we'll be dreaming of a day like this again here in Houston. Be all standing around outside wondering how in the world I'm going to get these clothes unstuck from me. I want to thank everyone once again for joining us today. The calls have been really, really good. And I just want to point out one more time, when I talked to Kim earlier, and he was talking about his small business and the mix that he has between his W-2 employees and his 1099 employees, that being able to offer a plan that both of those groups can be on together at an organization is almost unheard of. This is something just a few years ago that you would have never seen, period. The big companies that offer health insurance plans, you traditionally have to have all of your ducks in a row, and by that, all of your people on W-2. And they want to have more control over your plan than really you want them to. As you look at the different plans that are out there, there are really some great and innovative ideas that have come out, such as level-funded and self-funded plans. While many businesses can take great advantage of that, and it is really a good option, you can also have those plans and mix them in with things like Eagle Care Health Solutions, where people can have things such as direct primary care and health shares. And for many people, they're looking for those options. For many employees, if they were looking at giving their money to a traditional health insurance company, or looking to pool together with others of like mind to share in expenses, they would certainly choose that. They would choose to have a medical health share plan, or a health share plan, as it were, over funding an insurance company. I do get the question quite a bit of what is a health share or a medical health sharing program. And what it really is a like-minded group of people that have got together and they share medical expenses. And the industry, that is really called a need. You don't have deductibles. You don't have claims. Remember, it is not insurance. And if it's not insurance, then you cannot legally even use those terms. So I want you to understand that while it is not an insurance product, it still provides that peace of mind and comfort in knowing that if something bad were to happen, those unpredicted things, those accidents, or that diagnosis that you would have never dreamed that you would have to live with, then you can still get the help and support that you need. And that is what is so great about a health share, is that you don't have to deal with all the crazy red tape. You don't have to deal with that HMO mentality, as one of my young ladies in New Braunfels, Texas had to, as she had to wait over 6 months for hip replacement surgery because the HMO just didn't want to approve it. Didn't make any difference at all. The doctor said she needed to do it, that she had done everything and jumped through every hoop that they wanted her to. They just simply didn't want to do it. They were hoping maybe open enrollment would come along and she'd change her plan and somebody else would have to pay for it, right? But we've all seen claims get denied. We've all seen insurance companies act in what we would think in unscrupulous ways. They were just following their procedures. It wasn't necessarily unscrupulous. It wasn't wrong. It was just doing what they do. And if you've ever been trapped in an HMO, then you understand all of the red tape that you have to go through. You can't even go see a specialist. If your doctor tells you, yeah, you got a problem, you probably need to go see a heart doctor. Well, you can't just decide that you're going to go tomorrow and go see a cardiologist. Your doctor is going to have to give you that referral and choose who that referral is to. And that can be quite frustrating to a number of people, especially if you're in an HMO with a small network and you can't see the doctor that you want to see. Health shares typically are not going to have any type of network. Some of them may work with a network so that you can get a better deal, but they're not going to prevent you from going outside of that network to get the treatment that you need from the doctor that you want to get it from. I even know of health shares that work with surgery centers that give them discounts, and whenever you decide to use that surgery center, they may even waive your IUA, or your initial uninsurable amount. There's a lot of different flexibility in the health share, and if you look into those, the best way to figure out which health share is right for you is to talk to somebody who truly has no skin in the game and wants to make sure that you get in the very best one for your family. There are health shares that are Christian-based. There are health shares that are Catholic-based. There are health shares that kind of go across the whole gambit. And, of course, there are some that do not. You don't have to have any kind of religious affiliation to be part of. One of the things pretty much across the board that you're going to find with a health share is that none of them are going to let you just live this crazy wild lifestyle. You are going to be committed to taking care of yourself. You're going to be committed to making sure that your family plays within the rules. You know, if you go out there and you decide that you're going to commit a crime and you get injured in that crime, then you're unlikely to be covered under that health share because you're going to have violated the rules that you said, I'm going to live in a right way. Whether it's a Christian health share or not is irrelevant. When you choose to be part of a community, you're choosing that you are going to support one another and that you're going to live a responsible lifestyle. And there's nothing wrong with that, but there's just people that are not going to fit in that group also. A health share is not a good option for them. So I want to make sure that you understand that when we talk to you, we're going to ask you questions that in some cases may be uncomfortable, but we want to make sure that you have all the information. You need to make the best decision for your family, and it cannot always be about how much a plan costs. Sometimes you may love the cost of something, but it's not going to be the best for you because it's not the right fit. You need to be sure that you have the coverage that you need at a price that you can afford. And we're going to help you find that at Eagle Care Health Solutions. Once again, I want to make sure you have all the contact information for us. That is eaglecarehealth.com. Also, you can reach us on any number of the different social medias, both on Instagram, on Facebook, on Twitter. You can find us out there. All you got to do is just put in Eagle Care Health Solutions or Eagle Care Health. Also, our number is 512-859-5662. That is 512-859-5662. As we get close to the end of the show, I just want to tell you guys what a joy it is to be here with you on Thursdays. It is one of those things that I really never thought that I would be able to get my voice out and help as many people as I am by being blessed to be the host of this show. As I have gone around the country and shared knowledge about health insurance, shared knowledge about Medicare, about Social Security, and all the other facets that we touch on with this show, I get to touch my audience. I get to be in touch with them. I get to help them understand. I get to see the light in people's faces as they light up and realize that retirement may be closer than they ever dreamed, or retirement may be possible when they never thought it could be. I get to interact with folks and see what a difference I get to make. But having this platform, having the ability to talk to literally thousands of people at one time, it is truly a blessing, and I feel that way. I hope that you will join us each week. I hope that you will reach out to us if you have individual situations that you want more clarification on. Understand that there's never any obligation or any cost for a consultation or to talk to me or to talk to anyone at either FESA or at Eagle Care Health Solutions. We are here to help you. We are here to make sure that you have the best retirement that you possibly can, and we are here to make sure that you have the best health care that you possibly can have for your situation. And that starts with making sure that you are covered by the type of program and have the right kind of membership for your family. As you guys know, FESA, the Federal Employee Service Association, is a primary sponsor for this program. I do want to give out their information. They were just inundated with requests for information last week, and I would just want to say thank you once again from them. FESA is the Federal Employee Service Association. They do work now with private sector folks. You can find out more information on FESA at gofesa.com. That is gofesa, FESA.com, and their number is 512-687-6202. That's 512-687-6202. Next week, next week I will be in beautiful South Carolina with my family. We will have a pre-recorded show next week, and we are going to talk about a number of things. I really recommend that you take the time to listen to next week's show. It will not be boring. I will once again have Mike Strother with FESA. Easy for me to say, right? With FESA with me, and as we talk about the three-legged stool. Oh yeah, the three-legged stool. You're going to learn more about that, right? The three-legged stool is vital to your retirement if you ever plan on retiring. So I hope everyone out there listening does. If you ever plan on retiring, you're going to want to join us next week to hear about the three-legged stool so Mike can give you all the insights you need on retirement and how you can get headed down the right path. Once again, we are so grateful to be on the air with you. Appreciate you guys so much. Look forward to being live with you again in a couple weeks. Listen to us next week recorded. Thank you once again for joining the Health and Wealth Power Hour. This is Harlon Pickett signing out.